Hello, and welcome to animatedteeth.com and our page that discusses the postoperative complication of nerve damage following a tooth extraction. Dentists refer to this condition as paresthesia. We can only imagine the disappointment a person must feel as they discover this complication has affected them. Fortunately, it's possible to state that most cases of paresthesia finally do resolve on their own. So, one can only hope that that will be the case for you too. As you wait and endure, you'll no doubt have questions about what has transpired to cause your condition, and then, what may happen in the future. This video and its accompanying page should be able to provide that information. In regard to what has happened, paresthesia occurs as a result of nerve fiber trauma created during the extraction process. And, from that point of damage or irritation, and on towards its end, the tissues serviced by the affected portion of the nerve will experience altered sensation. The trauma that created your condition can take different forms. For example, the nerve might have received compressive force as pressure was applied to the tooth to loosen it up. If so, this force might have bruised or crushed your nerve. In comparison, direct damage would be caused if the nerve was nicked or even severed by a dental instrument, like a scalpel. Or, the fiber could be cut, torn, or stretched as a consequence of performing a procedural step, like raising a gum tissue flap, especially in certain risk-prone areas. It's even possible that a person's paresthesia is the result of trauma created during the injection of anesthetic. In this scenario, the trauma might be caused by the needle, the hydrostatic pressure created during the injection process, or even the chemical nature of the anesthetic itself. With such a wide range of possible causes, you might wonder how frequently this complication occurs. Paresthesia stemming from dental anesthetic injections is considered rare. During their career, a dentist will likely only witness a few cases, if any. With extractions, most paresthesia cases are associated with removing lower wisdom teeth. Our graphic here shows why. The roots of these buried teeth can have a close association with the nerve bundle that services them, and that places it at risk. As far as how often this complication occurs with this most likely type of case, study estimates vary, but we'll cite one that suggests that the incidence rate lies on the order of 2% or less. Additional risk factors include the degree of root formation. About 2/3 is usually ideal for removing impacted teeth. The age of the patient, where comparatively younger people usually fare better. And clinician skill and experience, where, of course, their having more generally helps to lower your risk. The precise symptoms that an affected person will experience can vary. And to explain how, we need to introduce a few additional terms. The one you already know, paresthesia, is frequently used as the catch-all term for this complication. But more precisely, it really refers to the situation where the affected tissues have abnormal sensations, like tingling or a pins and needles effect. If instead the patient notices a diminished level of sensation in their affected area, the term hypoesthesia is used. The total loss of sensation is called anesthesia. And the word dysesthesia applies to situations where the area produces painful or unpleasant sensations. Anyone experiencing this complication will be curious about how long their condition may last. A study evaluating lower wisdom tooth cases determined that the highest rate of recovery took place during the first 3 months. And at 6 months, 1/2 of all cases achieved full resolution. Generally, earlier signs of recovery tend to favor complete resolution. Cases that haven't resolved after 2 months may not recover fully, although they may. Cases still showing some sensory deficit after 9 months are even less likely to fully resolve. As far as signs of recovery go, any improvement that's noticed should be considered a positive. Precisely when improvement first appears varies, so don't be too disappointed initially. And expect your recovery to be gradual. Also, different senses, like hot and cold versus pain, may return at different times or rates. At this point in our video, you may have noticed that we haven't yet discussed how paresthesia is treated. And for the most part, no specific treatment is usually performed. A patient's recovery relies on their body's ability to make a repair on its own. Some dentists do employ the use of anti-inflammatory medications with their patients' paresthesia cases. And, as this page details, that includes some common over-the-counter ones. As a related point, We'll mention that it's hard to know how much improvement has occurred if the size, shape, and location of the affected area weren't mapped out initially. So, sensory testing should be performed early on and its results documented. Our page's text outlines what's usually done. For those cases where no or just limited improvement has occurred, especially over the comparatively longer term, an attempt at surgical repair might be indicated. Our page's text explains what sort of guidelines might be used when deciding. As a point of advice for those struggling with stubborn cases, keep in mind that many general dentists will only have a limited amount of experience with this condition. In comparison, an oral surgeon whose practice is primarily composed of performing surgical procedures will encounter this complication much more frequently. Based on their greater familiarity with interpreting case details, and an expectation that they would be more knowledgeable about current trends in treating non-responding cases, a referral for consultation might be considered. With that point, we'll conclude this video. Don't overlook that our accompanying page contains additional information we haven't discussed. So, give it a read. Also, if you're suffering with paresthesia, we wish you the best in your recovery. Good luck.